So let's talk about this unique cancer treatment, gentlemen. Again, it's called intraperitoneal chemotherapy. To make it a little easier, we also say HIPEC. So what is it? Dr. Diaz?
So heated intraperitoneal chemotherapy is essentially when we take patients to the operating room. In the operating room, if we're able to get all of the cancer out, what's called an optimal cytoreduction, we then, right there in the operating room, give these patients the chemotherapy. And so we distend their abdomen, we circulate the chemotherapy, we heat it to about 43 degrees Celsius, and that circulation of chemotherapy goes on for about 90 minutes. And so that way the patient gets the treatment right there with chemotherapy into the belly during the time of surgery.
And what difference does that make, if I may ask, in terms of getting that treatment right there at that time?
Yeah. So the benefits of cancer surgery is to remove all of the disease. And so right then and there, we know that we've done our jobs as surgeons. So we want to capitalize on that by giving the chemotherapy. We know chemotherapy works best when it's a low volume of disease, and the lowest volume of disease is right then and there when the patient has just had surgery. Additionally, by giving at that time of surgery, there are no adhesions that may form later on. So given the intraperitoneal chemotherapy, we know it will circulate throughout the abdomen. Some of the medications that we use, such as carboplatin, seem to work better when they're heated. And so by heating the chemotherapy, you get platinum adducts, and that works a little bit better.
And this is quite new, right, doctor? This is this new treatment? How new is it?
Well, I mean, this has been around for a while. I mean,
Okay.
the first description of a delivery system for intraperitoneal medication was actually described in 1977. And the first patient who received HIPEC was a young gentleman in his 30s who had what we call pseudomyxoma peritoniae, which is a type of appendiceal ruptured tumor, and this was in 1990. So this is something that's come along over the years, and it's coming now more into a better understanding of its role in multiple different diseases such as ovarian, appendiceal tumors, colorectal, and select gastric cancer patients.